Hello, everyone. Welcome to LearnTech Asia's webinar series. My name is Charlie Darapak. I'm the editor-in-chief of LearnTech Asia. At LearnTechAsia.com, we are an independent and impartial platform telling stories of learning innovation in K-12, tertiary, and workplace upskilling and reskilling in all communities in Asia. Today, we have Learn with Expert, interviews with experts in the EdTech and learning sector. Thanks for taking time from your schedules to be here. I hope everyone is keeping safe and sane. It's been back to school for many in Asia with social distancing in place. Online or blended learning continues for many others around Asia and other parts of the world. Today's webinar is the impact of COVID-19 on teachers' mental health, managing psychological and emotional well-being. We at LearnTech Asia have heard from many teachers and educators in the region who have shared their stories during the coronavirus pandemic. When COVID-19 began to close schools in Asia more than 7 months ago, learning was abruptly shifted online. Many students, teachers, and parents were caught unprepared. In addition to our healthcare workers, in many ways, teachers became the frontliners of learning during the pandemic, making sure that the learning didn't stop. In Malaysia, we heard about how WhatsApp was used to get assignments to students. In the Philippines, teachers worked hard to bridge the digital divide. We heard stories of teachers in Indonesia riding on scooters to bring the classroom to students without internet. Maslow before Bloom, we hear this all the time, the idea that educators should meet students' basic needs for safety and belonging before turning to the classroom and learning. We hear about parents who are struggling with helping their children with remote learning at home, while at times working from home themselves. Today, we want to focus on the teachers who have been under tremendous pressure. How have they been doing during the COVID-19 pandemic? I'd like to share with you a survey that we're conducting at LearnTech Asia on teachers' emotional well-being. We had over 1,400 people register for this webinar. Our survey is still ongoing, so please take it if you haven't already. Let me share my screen. So here's our teachers' emotional well-being survey. If you haven't taken the survey yet, please do so. The survey is still ongoing. You can scan this QR code or check for the survey information on our website or on our Facebook page. So out of the respondents, 94.6% of teachers said that COVID-19 had increased their stress levels. We also asked, on a scale of 1 through 10, how would you rate your overall occupational stress levels? Almost 75% of teachers rated their stress levels being 7 and above. An overwhelming workload and a lack of planning time were cited as the top 2 contributors to occupational stress. As you know, the shift to online learning was immediate. So many teachers were left scrambling to make sure that the learning didn't stop. Only 19.1% of teachers said that they get help from their schools in times of stress. And when asked if they wanted to have access to more mental health resources at work, 78.2% said yes. So please take the survey if you haven't already. We will compile the final results very soon on LearnTechAsia.com. Joining us today for our webinar are Issa Cruz from the Philippine Mental Health Association. She's a program manager for education advocacy and research. Her team is at the forefront of efforts to promote mental health, prevent mental disorders, and encourage people to become advocates by providing lectures and learning sessions to various members of the community. Issa is a registered psychologist and guidance counselor and has been a clinical psychology practitioner for the last 23 years. She's helped adolescent and adult clients who are diagnosed with depression, bipolar disorder, and anxiety. We also have Sandy Chafouleas from the United States. She's a distinguished professor of education psychology and co-director of the Collaboratory on School and Child Health at the University of Connecticut. Sandy authors a Psychology Today blog on promoting student well-being. Her work focuses on assisting schools in the implementation of evidence-informed policies and practices that support the whole child with specific expertise and strategies to strengthen mental health and emotional well-being. We've had an overwhelming response from those of you who are interested in this session on emotional well-being and mental health. Please submit your questions in the comments section and we'll get them to the speakers. Let's welcome Issa and Sandra to LearnTech Asia.
Morning.
Thank you.
Good morning.
Okay, good morning. I am Isa de la Cruz from the Philippines, and I am a mental health practitioner. And today I will be sharing to you some practices and things that you can do in order to improve your mental health as teachers, as educators. But let me just discuss first some things that are important in terms of information related to the stress and to the psychological concerns that you may have in terms of this pandemic or the COVID-19. So I am from the Philippine Mental Health Association, and it's actually our 70th year anniversary this year. And yeah, let's start with this. This is the usual scenario when we start school here in the Philippines. I have been a guidance counselor for around 3 years prior to becoming a mental health practitioner. And one of the usual scenario that we have is teachers preparing for the opening of schools. And as a guidance counselor, the opening of schools is really one of the most stressful time in the academic year. A lot of stress comes out during the first day of class. As teachers, as students, and as a guidance counselor, we experience a lot of stressors when schools open. And actually, teachers would be cleaning their classroom and preparing a lot of things prior to the opening of class. And you would usually see this scenario where they write a welcome back sign to their students or to their pupils. But this has changed. When the SARS-CoV-2 virus came and when the COVID-19 pandemic came, the preparations were a lot different. And not only in schools, but in a lot of workplaces. So the teachers have now, as was said a while ago, they are now preparing more for online learning. A lot of them, there are some teachers which are not that proficient in using the internet, using laptops, using gadgets, but they have been prepared, and it somehow caused them some source of stress or psychological challenge. And in the Philippines, it's not only online learning that is being implemented, it's a blended system of education. So aside from conducting online classes, the teachers were also busy preparing for modules. And part of the preparation would be training them on how to do that, how to conduct online classes, how to do the modules, and also distributing that to the students. So pretty much that would somehow impact their psychological and emotional well-being. And my task today is to really go through those things that may be threatening the psychological and emotional well-being of teachers, and also discuss to you more about mental health as well as the coping skills that teachers can do in order to become mentally healthy. What was the life of teachers in the Philippines before the COVID-19 pandemic? So I'm going to show you typical scenes in the public grade school classroom. So this is a typical teacher, and you would see that there are students um, there in the classroom. And usually, a public school would have bigger class size than the private schools here in the Philippines. And this is a typical high school class. You can see the class size is quite big, probably compared to the other countries. And this is the typical private school classroom. You can see that they have more technology. They are more equipped in terms of materials, tools, as well as the students are. They have more resources for learning. This is another private school in the Philippines, and as you can see, smaller class size. But later on, we'll see what were the stressors of the teachers, even during the coronavirus pandemic came. But before that, let me just delve into mental health a bit. So, what is mental health? Mental health is the state of our well being, which is seen in our thoughts, our feelings, and also in our actions. So, practically, it's like physical health. It's the state of how we are at this point in time in terms of our thinking, feelings, and actions. It is said that if you have higher level of mental health, or if you're more mentally healthy, you have higher level of self awareness. And what we do as a psychologist is to test that, just like how we do thermometer reading to those who are sick. What we do as therapists is we ask first, how does a person feel today? Of course, not all of you can answer this, but in your own, I would like you to think and check yourself. How are you feeling today? Are you feeling happy? Are you feeling sad, scared? Are you worried, confused, angry? What do you feel right now? Because that will give you somehow an idea of how you are in terms of your mental health at this point in time. Okay, how is your mental health? The World Health Organization actually said that there are four characteristics of a person who is mentally healthy. Number one, you can check yourself actually if you have this four characteristic to also know the index of your mental health present. Number one is you realize your potential. So as a teacher, if you're good in music, you may be now a music teacher. If you're good in English, you can be the English teacher. Or if you're good in research, you should be a teacher in research. And you can cope with the normal stressors of life. But this is now debatable because the COVID 19 presented us with an unprecedented level of stress. So that in itself would prevent us from coping really. But we will talk about that more later. You can work productively and fruitfully. You're not only busy, but you're able to do work or to get an output which is happy for you. You get happy about it, and your supervisor is also happy about it. You can contribute to the community. The COVID 19 has allowed us to do some volunteerism work in responding to the health and the mental health needs of other people. So, as a mentally healthy person, are you contributing to your community at present? I would also like you to see mental health as a continuum. So it's not binary that you are mentally healthy or you have mental disorder. Your mental health would vary in different times of your life depending on the situation that you are in. You can have positive mental health. You can be reacting to something at this point in time, meaning you're feeling a bit of stress. You can be symptomatic, meaning at this point of the pandemic, you may be experiencing symptoms like insomnia or some degree of anxiety, which you are finally finding difficulty handling. Or I hope not, some of us may be in the mental disorder or mental illness side of the continuum. Now, we'll talk more about this in a while. So, the COVID 19 virus changed our perspective of what mental health is. We are saying, as mental health practitioner, that at this time, it's okay not to realize your potential, cope with the normal stressors of life, work productively and fruitfully, and not contribute to the community. But it's okay, but you have to do something about it. So you would go back to being having positive mental health. So, why is the mental health continuum important? It is important to know where you are in this continuum because it will allow you to determine which intervention you need or what help you need. If you are positively mentally healthy, you can just promote that. You can just go on with what you're doing. If you are reacting or you're in some kind of distress, you need to do preventive measures in order to prevent yourself from being symptomatic and from having a mental disorder. If you are currently symptomatic, if you have anxiety or if you have depression but not yet diagnosed, To prevent you from to allow you from lessening those symptoms, there are self-care practices that you can do. But we're going to talk more about that in a while. And if you have mental disorder, the intervention would be to help you recover. So there are care practices that you can do. Okay, the greatest threat to our mental health is stress. We all know what stress is. It is our body's response to a demand that is not the usual demand that we are presented to in our life. And those things that demands those from us are what we call stressors. And we have to remember that not all individuals interpret the same events as stressful. What may seem stressful to you may not be stressful to me or to some of your friends. But the coronavirus pandemic is, I would like to claim, very stressful for all of us. Now let's look at the comparison of what the stressors are of the teachers before and after and during the coronavirus pandemic. So before the COVID-19 pandemic came, there is this study in the Philippines about the stress among public school teachers. It was conducted to 42 public school teachers in a public national high school. And typically, most of the stressors are this. The teachers identified that hazardous working conditions, relationship with administrators, lack of financial security and materials were their common stressors. So you can just imagine the because this was conducted in a public school, of course there were not much financial security in terms of the salaries and the materials and resources that they can access. So that pretty much causes them to experience a lot of stress. And they are able to cope even though they are stressed. And most of the coping would be going out and eating out with friends. These were the identified coping of the teachers, discussing their concerns, and typical of Filipinos would be resorting to humor and jokes in order to sort of mask the stress that they are feeling. So that is before the coronavirus. But when COVID-19 came, the Philippine Mental Health Association conducted a survey on the stress level and coping styles of educators and guidance counselors. This was conducted over the span of 3 months. And that was from the week of June, last week of June to September. And this had 114 respondents. So what we used was the perceived stress scale. And we found out that the mean stress level of the teachers and the guidance counselors were 27.11. So for reference, 27 to 40 may be interpreted as high perceived stress. So if you look at it from this perspective, you would notice that a lot of the teachers have moderate to high level of stress. A lot of the teachers and guidance counselors are within that score. And what were their sources of stress? For their personal life, a lot identified, of course, the COVID-19 pandemic. Remember that this survey was conducted prior to the opening of class. So a lot of them were afraid to go out, and they are afraid and are stressed by the limited mobility. Of course, financial problems. A lot of the Filipinos would be afraid at that time because we don't know if we still are able to go to work or we still have work. A lot also of the teachers declared work in general causes them stress, as well as concern for the health of their loved ones. So those are the top five. In terms of their professional life, a lot of teachers would declare that workload is one of the main stressors they have. We would understand because at that point in time, it was the time that they were preparing for their online classes, for the modules, for the blended learning strategies that they are to do should the class opens. And then also, a lot of them are stressed about working from home. Why? Because they have to have work-life balance. They are a mother, a father, but they at the same time, they have to work the tasks that are given to them as teachers. So job insecurity, adapting to work online. So these are the stressors in terms of how they see their professional life at that time. How do they cope? A lot of teachers would we gave them the brief cope inventory, which actually measures how they are able to cope or what are their coping skills in terms of stress. And you would see here that a lot of them are resorting more to approach coping. Okay, let's delve more into that. So if you break down their approach coping skills, so these are the results. A lot of them resorted to active coping, meaning they deal with the problems and do something about it. A lot of them also resorted to acceptance, accepting that there is COVID 19, that they have things to do and they need to do it. And what's good is a lot of them also resorted to positive reframing, meaning thinking or looking at COVID 19 or the situation in another light, probably seeing what is good or what positive things came out of the situation. In the avoidant coping skills, a lot of them resorted to self distraction, meaning they distract themselves. They do other things, maybe chores, resorting to watching Netflix or other things that they can do in order to take their mind out of the situation. And similarly to the coping that was seen before the COVID 19, a lot of them would vent out or would say out how they feel and think about the current situation that they're in. What's typical about this is a lot of the teachers also resorted to religion, which is typical in the Philippines because we are a predominantly Catholic nation. And aside from Catholicism, there are a lot of religions also that are prevalent in the Philippines. And it's good to hear that a lot of them resorted to that because a lot of their responses would say in elaboration, for example, that they really resorted to pray when we ask them for open-ended responses. And these are the usual things that they identified in terms of how they cope with stress. And they look forward to in the future, of course, they look forward to the discovery of a vaccine, going back to their normal lives, better peace of mind, and better mental health. So there. Um, Long-term stress, if this persists, this can harm your health, and it will subject you to a lot of physical and also psychological concerns. And we don't want that to happen. That's why we're discussing this now. That's why we're here, because we want to give you some tips on healthy coping, right? So, what we can do, the first thing that we need to do is to acknowledge our stressors, and we take note of that. Our mind is like bucket or glass that if you fill it with a lot of stressors, of course, you cannot think well. But if you take out all those stressors, write it down first, and see what you're dealing with, that solves half of the problem. Recognizing what stresses you. All right. You also need to tune into your stress mindset. Are you looking at stressors or challenges as challenges, or do you like classify them already as problems? We have to reframe the way we look at stress, because if you reframe the way you think about stress, your body's response to stress also changes. You can like look at stress as either depleting your energy, or you can look at stress also as you getting energized and getting ready for something bigger. So it's reframing. Very important during this time of pandemic is to seek support and to share how you feel with other people. We call them emotional PPEs. If we have physical or hospital PPEs that the doctors wear, your emotional PPEs, you really need them in order to protect you from the psychological effects of this COVID 19 pandemic. And how do we do that? We share with friends, we keep in touch with our friends. Sharing a good luck with friends will really help you a lot, and it lessens the physical and the psychological impact of stress on you. Very important also is to know what are in your control and what are not in your control. Those things that you cannot control, you have to let go of all those things. Those things you can control, those are the things that you have to focus on. As teachers, as guidance counselors, or as educators, you know that you cannot control the system that the government wants you to teach the students with. But what you can control are your preparations, your own preparations in terms of how you will approach the problems that are being thrown at you. You have to be more aware of your strengths and weaknesses, because that can really help you a lot in terms of setting your goals. And acceptance is really very, very important, because there will be things which will not be in our control. We cannot invent the vaccine at this point in time, but we can do self-care practices. So those are the things that we have control. Another thing that is in your control is your practice of positive thinking. Even if the situation right now is very stressful, we can always look for what is positive in what's happening right now. Did it give you more time with your family? Did it give you more time to think and have clarity? So those are the things that you can ask yourself. Do not say anything negative to yourself that you wouldn't say to other people. And in positive psychology, we always teach that when a negative thought enters your mind, think of three positive ones. It is gonna flip the script in your mind. If you are stressed with one thing, do three positive things. So you will be able to flip the emotions that you feel. The negativity will become positivity. And another important thing is to draw on your past coping skills. The previous experiences that you had, the adversities that you had in the past, even before the COVID-19 pandemic, tap the strength that you were able to use at that time and magnify that and use that in order to overcome whatever challenges you have right now. And we also prescribe practicing mindfulness. Due to the interest of time, we cannot go through the whole mindfulness exercises, but this is what you can look it up in the internet, and there are mindfulness practices there that you can do, and it will help you a lot in terms of clearing your mind, focusing on the present moment, lessening the feeling of anxiety or depression that you have, and be able to think clearly. And of course, in line with our preparation also with not getting defeated by this COVID-19 virus, we need to stay fit and healthy. Eat a balanced diet, get enough rest and sleep, 6 to 8 hours of sleep. That's best for you. When you eat, you must be conscious about incorporating sufficient and healthy foods in your diet. Do not resort to drinking alcohol or drugs to deal with your emotions. They will just all the more cause you some problems later on. And it's very important to exercise or engage in any physical activity. In the Philippines, a lot of us are still at home. We cannot yet go out much. But in your own houses or in your own home, you can still do some physical exercises. I'm not sure if you can read these resources, but there are a lot of help available in the Philippines. One of them is the Philippine Mental Health Association, where I belong. We have a Facebook page, and you can, if you really cannot anymore handle the stress or the anxiety or the depression that you're feeling, you can contact us first to that Facebook page. There's also the National Center for Mental Health. They have a helpline, a crisis helpline. If you really feel distressed, you can call them. There are a lot of associations like the Philippine Psychiatric Association, Psychological Association of the Philippine Guidance and Counseling Association that you can touch base to in order for you to get professional help and discuss with them what you're undergoing in terms of this time of pandemic. And there are a lot of hospitals also providing psychosocial support. So let me just end by this slide. Out of the suffering have emerged the strongest soul, and the most massive characters are seared with scars. I know that as educators, as teachers, even before the coronavirus pandemic, there are a lot of challenges that you've been experiencing already. But when you come out of this pandemic, being able to adjust to what is being challenged of you, you will come up strong, and you will be able to do better in all of the other challenges that you will have in life. So thank you very much. I guess my other co-speaker will be able to elaborate more on the topic. So I give the floor to you now, Sandy.
Hi, everyone. I'm just going to get set up into presenter mode and hide that. Thank you to my co-presenter for starting us out with some really wonderful strategies on what we can all do as adults and children to build that emotional and psychological well-being. I'm going to, in my presentation, start at that continuum that she was showing around promotion and prevention, and really emphasize very specific strategies we can do in schools with our teachers and with our adults. Just to start us off, this is a little bit about who we are at the University of Connecticut Collaboratory on School and Child Health, or CSCH. And I start by sharing that because this is the model that our Centers for Disease Control have shown or have developed and put out in terms of what is a healthy school. And I want to start with this before we get into strategies, because I want you to look at the blue circles that go around. We see that the child is in the center, because I think that we all can acknowledge that schools are here to support children in their success and their journeys in life. But to do that requires a lot of things. So look around that circle for a few minutes, and being able to integrate and pull together all of those parts is what makes it successful. So the work that we do in our collaboratory is really about taking each of those gears, so those 10 blue circles, and figuring out how do we put the whole together, because the whole is bigger than the sum of its parts. So how does this relate to teacher well-being? Here's the topic of our presentation today, because the focus on teacher well-being is critical in those gears. And if you look at the gears here, we have employee wellness, or teacher well-being is one of our critical 10 pieces. And employee wellness butts right into having a social and emotional climate that is positive for people to live in, having a safe environment physically and emotionally, and having the behavioral supports available to you to help you be as successful as possible. So in this talk today, I want to focus on teacher well-being, or the employee wellness bubble, and how those gears circle together by focusing on some very simple strategies that anyone can use to foster what we mean by an emotionally safe school environment. The report that's associated with this particular presentation you can find on our website. It's freely downloadable, so I just want to give a shout out to that report, and then also to my co-authors, because this was a joint partnership between a few different entities that work with our collaboratory. So jumping in, what is a safe environment? I think we've heard from Charlie and we heard from Issa that it involves, we're certainly dealing with physical spaces around what is safety. But another piece to that is both physical and emotional elements that can help us promote the adaptive responses, so that promotion and prevention space that Issa talked about, and also can reduce negative responses that we might be experiencing by giving us support and connection. And to do that, to create a physically and emotionally safe environment, involves every person that can strengthen the core environment, the core of what's going on in our schools. And those core strategies, because we have lots of different people that work in schools, we have adults, we have kids, we have families that intersect. So the core strategies that we're doing have to be really simple. They have to be things that can be easily built into our routines and can be widely used and adapted by all. So what is a simple strategy, or why focus on teachers? And Issa set us up very nicely with that, because we know that teacher stress is being clearly documented to student well-being, but we also know that the response to trauma, like the things that we may be experiencing during this pandemic, are very individualized for kids. And here's a little picture that kind of shows all the different pieces that can increase your risk. But just like for kids or children and students, the same applies to our adults. So the same types of factors can apply to adults. So even though, even though the reactions, here's an example of different types of reactions that we might see in response to the different stressors and traumas that are being associated with this pandemic. The reactions are pretty common. They can include fear, anxiety, sadness. We heard that from my co-presenter, but they may look different based on stage in the life course. So why focus on teachers? because teachers are part of this continuum. Teachers are part of everything that is being experienced as well. And as we saw in both Charlie's slides and in Issa's presentation, teachers are facing additional burdens because of the responsibilities that they're being faced to handle. So what do we do about all of this stress? We had a very nice continuum before that talked about promotion, prevention, response, and then recovery. I want to focus on the bottom part of the core. So in the United States, our school systems are built to use this prevention science triangle way of thinking about what are the core things that we do at the bottom that can help the vast majority or the greatest number of people promote what we mean by a safe environment. So we use prevention science in the promotion and prevention of risk. And the very core of those strategies is really enabling familiar structures and routines. We crave as humans predictability and routines and structures. And when all that is disrupted, that happens to increase all of the stressors and exacerbate the symptoms that we might be having. So one of what we mean by a simple strategy or a core strategy is focusing on the things that can put some of those structures and predictability in place in a positive way. So a core strategy, I think I already referenced this, is simple. It's also referred to as a kernel sometimes. We've seen that in some of the literature. Basically, a core strategy is simple, it's evidence-based, it's cost-efficient, very easy and cheap to do, and it's highly usable. So those are the key features of what we mean by a simple strategy. And a simple strategy can work in two ways, at 2 points for intervention. That's what we see at the bottom of this picture here. One is that we can teach the individual. So we can use it, you have a simple strategy that an individual uses. So whether that be a student or an adult or a teacher. The other way that we can do it is by others. So other people use the strategy as applied to helping an individual with fostering their emotional safety or emotionally safe environment. So we can do intervention at the individual level and at the other level, helping those individuals. Simple strategies also work in a behavioral continuum. So we can do three things. We can prevent the occurrence from it even happening. That's what we refer to as an antecedent. So it happens before something happens. We can actively teach in the middle, this behavior space, actively teach the strategies that we want that can promote adaptive responses and decrease or counter maladaptive reactions. And then we also can respond to reinforce the positive. And again, the simple strategies fall right in the middle. So the things that are evidence-based, usable, and very cost-effective are right in the middle of my box here. And we selected them from work that was done quite a while ago by Bigland and Embry. And we curated the lists of strategies that they had found that were evidence-based for changing behavioral health. And we targeted the behaviors or the changes or the outcomes that were highly relevant to what we're seeing in a COVID situation. And also those kernels or those simple strategies that could apply to all populations. So both teachers and students in schools. And so I'm going to very quickly just run you through the examples of the crosswalks or the curated list that you'll see in that report if you wanted to go and take a look at it. So we'll start with the antecedent strategies or the antecedent simple strategies. In Embry and Bigland's work, these are pretty much the physiological things, the things that can do to change your physiological response so that you're ready. I think you're ready and you're feeling positive as we're going into a situation. And so I pulled out the pieces in the report. In our report, we also focus on students, but I pulled out the piece on staff and families so you could get an example of what this looks like. And I'm going to share a couple of slides next that will give examples. But you can see here we picked two kernels. One is aerobic play or behavior, and the second is a positive greeting. I think aerobic play or some type of physical exercise is fairly self-explanatory. But the problem is, or the issue or the struggle is how do we make sure that it actually happens and how do we fit it in? So our suggestion is that our school leaders can provide suggestions and ways for staff to take breaks throughout the day. And I'll share with you the example that the Alliance for Healthier Generation has on my next slide. On the positive greetings, it's as simple as it seems. Again, each of these strategies is simple. We can make sure that our school leaders or our colleagues are in the hallway and greeting teachers during we're past the first week back to school, but in an ongoing way. We can send electronic greetings and messages of welcome. And these are the outcomes in here. I mean, I think we'd all like to see some of these outcomes that have been proven or shown to work when you implement this type of kernel. So as an example, the Alliance for Healthier Generation, the Teachers Take 5 is a little simple questionnaire that a teacher can fill out, like, what's your favorite way to take 5 minutes that leaves you healthy and happy? And they're all movement-based activities. 5 minutes can be fit into a day. We don't need to think about these as like running marathons. 5 minutes, 5-minute breaks. Okay, moving on, let's go through coping kernels. So now we're in the middle of that picture that I shared with you. So we're in the behaviors. And coping kernels, and Issa had mentioned some of these already. So we have ideas about nasal breathing, progressive muscle relaxation, and self-monitoring. So if we look here, you can see the kernel and the definition of what it looks like, what the outcomes are that have been shown to work within the literature. So let's see, self-monitoring is fairly self-explanatory. We can use, just like we do with students in terms of monitoring their work completion or monitoring how engaged they are during school today. Staff can use self-monitoring to evaluate their own behaviors when they're getting started and moving forward throughout their day, so that you know that when you're following more toward that frowny face on Issa's scale of not coping or not doing well, that it's time to do something so that we can, I think she mentioned the word flip the switch. So flip the switch back to being more on the green side of the happy space. Nasal breathing has been long known to create this physiological sensation that can reduce panic, anxiety, and hostility. We can consider doing things during staff meetings. Again, these are like very short and simple activities. We can embed them into the classroom so that staff and teachers are doing these activities right along with students. And that's the same for a progressive muscle relaxation exercise in terms of like walking through a script or a video or a demo of how to use it. Very simple opportunities. The issue is being able to schedule or make sure that we find those times in the day that you can use these strategies. So again, you can click on any of these examples that we have on the right side of resources to find examples of what these scripts look like. I just pulled a couple of examples that I found very quickly yesterday. There's a YouTube curated playlist of different breathing technique videos that are pretty short and easy and could be done and watched by teachers in schools. Or my favorite is to do, as I said earlier, to think about how can you incorporate the idea of nasal breathing or a progressive muscle relaxation script into the classroom so that adults are modeling and then getting secondary benefits from that modeling with students on how to use the strategy. So here's an example on belly breathing. And there's the little card that shows you how you can put that into place and how we can use that with kids at the same time as we're doing with students. Okay, two more pieces of our kernels or simple strategies. Now we're on to the side end or the consequence side, and we're looking at strategies that can increase positive responses and also then strategies that can decrease maladaptive responses. So examples here we have our verbal praise. Everybody likes verbal praise, right? And so when we have that school leader get in there and say, hey, I know this has been really hard and super committed to, I see your commitment to students, let's keep up the great work, super proud. Just like with students, adults crave that as well. I like the idea of toodle notes, and we use them through the end of the school year in the April to June space in some of our schools and some of our projects, where school leaders or even their colleagues would write these little notes, these little praise postcards, and send them virtually to their peers to give them shout outs and makes you feel good. And then this idea of special play, which sounds like a student word, but it actually applies to adults as well, is how can we find time or schedule time within the day to make sure that we aren't always focused on the work-related demands. How can we create social opportunities or a wellness activity that creates a special play moment for adults, just like we do with kids? Here's an example of that virtual postcard, that the Toodle Note that we talked about, and you can get this and download it freely. Again, this was held in the United States during we have a Teacher Appreciation Week, so this was particularly targeted back in the early pandemic times, but it certainly can apply all along. Is this idea of using ensuring that school leaders are part of providing the positive praise and the special comments and the verbal praise to their school staff. The Boys Town reference that was on that slide, the reference slide, basically summarizes things like this: is we need our school leaders to give time for teachers to express how they're feeling and give ideas on how to be creative in getting through some struggles or issues that we're having, and be free to be honest and give honest feedback. Specific praise we've already covered as an example, and then being pleasant. So I think using humor right now is really important. Laughing at ourselves as things are going through can break a tension in things that are happening. So we need those school leaders to be really involved. I think you're getting the sense here that I keep saying school leader, and I was looking both at the comments that are coming in from different groups, and also in Charlie's survey results. And basically, people are saying that they need help from their school leaders, that it feels overwhelming, they need planning time. So we need to have our school leaders involved in helping to deliver and make sure that we can implement these strategies. All right, moving on to our last one. Now, what are the kernels that we can do, or the simple strategies that we can do to decrease maladaptive response? We have two here. One is a positive practice, and the second is a low emotion or a private reprimand. So school leaders or other school staff members, when we need to give feedback to change a behavior or to do something a little bit different, let's make sure that we're doing it individually in a calm and neutral way. And I'll share an example of that in a second. With positive practice, these are all new behaviors. I think you mentioned this, like the technology demands that have happened to teachers feels like it was overnight, right? So of course that's not going to be perfect at the first get-go. We need to be able to have positive practice and opportunities to role play and use the different skills that we're learning. So here's an example of the, let me just go back, of the low emotion or positive reprimand using what's called WISE elements. We can do something like a feedback description. So, we're asking you to be checking in with students during remote learning to make sure that everyone is engaged. And we've asked you to do that at least twice a week. And it hasn't been happening. So I realize it hasn't been happening, and I'm sure it must be a struggle. So let's talk about what are the challenges that you've been experiencing, and let's talk about what the solutions might be so that we can make sure that we're meeting the standard that we've set for how often we're going to be connecting with students who are doing remote learning. That's pretty much my summary. So again, we put that all together, and we can see that there are things that, again, at the bottom of this this little picture that's a snip from our report is the things that we do for ourselves, or that teachers can be doing, and strategies we can be implementing. And there are strategies that we need others to do that will help us create that core foundation of emotional success. And they're all lined up in this way, and you can see them that way. And I think that will be the end of the presentation, and we'll be ready for conversation. Stop sharing. Here we go.
Thank you so much, Sandy, and thank you so much, Isa. Great to hear perspectives and strategies from opposite ends of the world. There's a lot of questions and a lot of interest. Things that were said about checking yourself, which is applicable to both sides, and also what Sandy was talking about. The physiological kernels with positive greeting. How are you today? I mean, that counts so much in what's going on now. And these things can also be done not face to face. It can be done electronically. We have social platforms now. We have messaging apps. But enough of me talking. I will throw up some of these questions. We have a lot of questions. Sandy, you covered some of this, but there's a question on what can unit heads do to help their subordinates maintain their emotional well-being, even when they themselves have a difficult time managing their own well-being?
So that's a good question. So first, I think the first thing is to have self-awareness. So it's good if we have self-awareness that we're having trouble with our own well-being. And so if we can't be the beacon of positivity right now, we need to make sure that we can find somebody else that can help us do that. The other thing is that if you're able to even just push it a little bit, right? Sometimes the act of doing it for others, right, and being positive can, I think ICU said very nicely, like the flip the switch, right? So somehow that then becomes a switch for yourself to be able to improve your own well-being. So it's, I think it's, again, this kind of community effort to understand where you need your help, where you need help. But if you are the leader of the organization, acknowledging where you are and what help you need to do to make sure that your staff can be well.
Isa, do you have any thoughts on that from maybe a slightly different cultural perspective in the Philippines?
Well, from us, I think it's typically the same. The unit heads themselves are having difficulty really balancing supervising others as well as taking care of their own well-being. But it's just as Sandy said, it's always good to really go back to yourself and see how you can still evaluate which of these things are in my control and which are not. I think that's very important because it will allow you to realize that maybe what I'm trying to see as a problem is really not in my control and I really cannot do something about it and I need help. So something like that. That's actually what has to be done when you are faced with a situation which seems very difficult and you cannot get out of it. Something like that.
Okay. Sandy, you said earlier that every person is involved in strengthening the core environment. We all play a role in this continuum. I guess it leads me to this next question. Someone is asking, how can I speak to and help someone with a mental health problem like depression or anxiety? I guess this questioner is asking about maybe they identify a colleague, if perhaps they're not in a leadership position, perhaps they're a peer. So what can they do?
I think the most important thing would be to look for someone whom you can trust, whom you're comfortable with. Because it would be easier to really discuss whatever you have there inside and whatever you're thinking or feeling if you trust the person. So it need not really be your family member, it can be a friend. And it really need not be already a therapist, unless, of course, the depression or the anxiety is already causing you some difficulty with work or doing your regular personal activities, which is already probably an indicator that you are having some symptoms of something, in which case you really need to get to talk to a professional. But if you're just in the earlier phase, you're just experiencing some anxiety, which is not debilitating, you can look for someone you can trust and talk about it to that person.
Yeah, and I think it's really important to emphasize. I love how you're saying too that you have to figure out where you are in the continuum, right? And that's individual per person. But I think it's also important to acknowledge that we're all a little off on our continuum, right?
Mm-hmm.
So our normal is not really normal.
Yes.
So it's understanding, because I see a lot of questions like, well, how do I know if I need help? So I think first of all, talking to your colleagues who know you, who knew what your pre-pandemic was and what you are now can be helpful. And also understanding, have we all just moved a little bit to where the normal is, or have I moved a little bit too far where I need to go get some professional help? And that's kind of the balance that we need to start. But I think a big part of it is people get even more anxious because they don't feel quite right? Their brain feels foggy today or something like that. Well, we're all having those moments, right? At different times and at different spaces. So I think that's really important as a start. It doesn't mean that you're way over here.
Yeah.
I know in most of Asia now, teachers are pretty much back in school, right? The Philippines was amongst the last places. I said, is that true? I know in some pockets of Indonesia, they still have some zones where students are doing remote learning, and also in the U.S., depending on school districts. I know in New York or whatnot.
Yeah,
Yeah,
Here
it's
in the
all different.
Here in the Philippines, a lot are on remote. So
Okay.
yeah, a lot of teachers and students are learning through online, but there are areas here where students are being given modules. They tune into television or radio stations where they can access the learnings or the lessons, and there are areas where there is face to face, but I don't think there are a lot of those right now.
So how are teachers supporting each other remotely
Well,
if they're not seeing each other as they would in school? And if you guys can share tips and tricks, maybe in your part.
So that's a great thing, and actually we are going to be releasing a podcast, I think later this week or next week, that talks about employee wellness strategies that schools are doing. So a lot of our or many of our schools, or the people that are going to speak to us, are talking about how they have mandatory, which seems kind of weird, but mandatory professional learning time, and some of that is focused on mandatory wellness training. So some of them have like buddied partners together, and you have to be connecting in a certain time, or you have to be doing a certain thing. And of course, at first you're like, I don't want to do this, but what they're finding is that is, again, creating a structure, right? Creating a predictable opportunity or experience for you to take that time, usually on one of our remote days, because even if our schools are in person, they're often one day off or something with other remote pieces, although we flip every day depending on what the rates look like in the different towns. So that's one strategy I know they're using. So it's kind of like this idea of creating a cadre or creating a community, and actually talking about this stuff, not just like, and assuming everything's fine.
Yeah.
Right.
I think
the people who did the panel are much better than I am, so you can go listen to their podcast when it comes out and listen to what they have to say.
I think here in the Philippines, the Department of Education has prepared the teachers in terms of trainings and webinars that have allowed them to be prepared in terms of the remote learning. And I think I would like to believe that they also have regular check-ins with the teachers and their co-teachers in order to support each other in terms of both technical and also probably emotional and psychological support.
I want to come back again to some questions about people asking for help. That seems to be the recurring theme here. So here's a question on what are the symptoms that we should look out for before we seek professional help. I think people are checking themselves and they're wondering, is it time for me to reach out? What should I do?
Okay. As I said, it's very important to determine whether or not these symptoms are already debilitating or causing you some difficulty performing your daily day-to-day activities. If you're a teacher, for example, and you really cannot go online or go to class because these symptoms are really preventing you from doing so, I think that's the time that you really need to seek professional help. But even before that time comes, it's very important to talk to someone already. You don't need really to wait to be totally debilitated or to be totally unable to perform your duty for you to seek help. Once you feel not that comfortable already, it may be the time to seek help or to talk to someone else.
And we make a plug that if you are feeling like you're going to harm yourself immediately,
Yes.
or harm someone else, that you immediately call your hotlines. You had some wonderful hotlines that were listed. We have them in the US. I assume you have them in other places too. You immediately go and seek help.
Yes. For the Philippines, if they want to seek help, there is this usap tayo, or let's talk to each other hotline that they can reach out to if they feel that they want to harm themselves or they're not feeling okay, they can reach
Yeah.
out to that. And also to the Philippine Mental Health Association. We have a Facebook page wherein we take in some questions and we refer them to professionals who can help them with their psychological concerns.
I mean, it's tough now. We don't see our colleagues all the time. Everything is done remotely. It's done through short messages on WhatsApp but I guess being a good friend and a good colleague is important too. Check in on your colleagues. Ask them how they're doing, because everyone, I guess, processes differently and internalizes things differently. So sometimes we may have to up our radar if we're around people who need help, but they're not asking for it. Let's see. You see anything here that you want to address, Sandy and Issa? There's a lot of great questions here. I want to wrap this up because it's midnight where Sandy is.
I know.
So thank you so much for being on with us.
Good news is I feel like I've gained another day though, because you're already on Wednesday. I just turned to Wednesday. I'm still on Tuesday. No, again, I just think that a lot of the strategies we've talked about have really emphasized the idea that we need to move to kind of these prevention and promotion strategies. We know we're experiencing these things, so we should be doing something to think about what are the things that make you feel good about strengthening the core of your well-being and in your school and the climate in your school to be comfortable to do that. For some of us, it's exercise. For some of us, it's nasal breathing. For some of us, it's cooking, and healthy cooking. But we need to make sure that we're purposefully scheduling the time to put those things in place. And amidst all of that, connecting with people around us in the ways that were possible.
I think to further strengthen what Sandy said, it doesn't mean that if you don't feel anything off in how you think or feel that you're already okay and you can just do whatever you want. It's good to be really preventive in terms of not exposing yourself to things that will really threaten your mental health. It's good that you may not be feeling any stress or anxiety at present, but it's also good to do self-care even if you're not having those kind of or feeling those kind of symptoms.
Yes.
Yeah.
Yep. The teachers are really the heroes during this pandemic.
Yes.
There's a lot of stress. There's a lot of going on. They're being leaders themselves for the students that they're responsible for. I'm going to wrap up this webinar. Thank you so much. The impact of COVID-19 on teachers' mental health, managing psychological and emotional well-being. I'd like to thank Issa and Sandy for sharing with us their insights and strategies today. And thanks for reminding us to check ourselves, to check your friends and colleagues, and to seek help. And Sandy, once again, thanks for being here at midnight your time. Thank you to the audience for watching and contributing to the conversation. I'd also like to say thank you to my colleagues, Sao Fong Ho and Yo-Yo Zheng, for their tireless work behind the scenes. This webinar would not be possible without their help in making this happen. For everyone, we'll be posting a video of this discussion on LearnTechAsia.com, and we'll share the links mentioned in the presentation. Sandy and Issa, if you can send the decks, I'll extract the links from there to share with our audiences. Great resources and strategies in dealing with teacher mental health and well-being. If you found this valuable, please be sure to follow us on Facebook and LinkedIn if you aren't already, and do sign up for our newsletter on LearnTechAsia.com. My name is Charlie Darapak, the editor-in-chief of LearnTech Asia. See you next time. Thank you, Sandy, and thank you, Issa.
Thank you.